DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and today we're going to have our 2022 wrap-up show. Kind of go through some of the things that happened this year in the beef industry and then animal health, and talk about a few things that are to come in 2023. It's been a blessed year for us, and I hope it has been for you as well. So for Kelly and Heather and myself, who are the partners and owners of Farming Unlimited, which produce DocTalk, we're very thankful for you. Stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and it's a pleasure to be with you today. It's the end of 2022, and we're going to do kind of a recap or a look back through the year, things that have happened. I'm a professor at Iowa State part-time, and also an owner and operator of my own veterinary practice, where I work with cattle and people across the United States, and this year has been no different, where I've spent time in Whitman, Nebraska, and out to Nashville, Tennessee, and Birmingham, Alabama, and Starkville, Mississippi, and all over the Midwest, Kansas, South Dakota, and got to be with a lot of wonderful people this year. And we all have the one thing in common: that's we enjoy this beef industry, and we enjoy our freedom, and we all have faith. And so, as we look at what happened, you know, the big thing or the big discussion this year has been the drought and things that we have had to go through in learning how to care for cattle in drought-stricken pastures, how to care for calves with early wean methods, and actually the cows teaching us that, hey, I'm done producing milk, I got to take care of myself, and weaning those calves themselves. And so we have seen a constant decrease in the inventory of our beef herd because of liquidation due to drought, people bringing cows in. We've had an increase this year of cows being culled and cows going to market, but we have maintained feeding the same number of heifers as we have in the last few years. So if heifers remain the same, culling of the cow herd has increased, that means that we are decreasing the number of cows out there, which will then result in a decreased offering of feeders in the years upcoming. And that looks really good for feeder prices. But if you flip the thing on the other side, that the high feeders prices going into the feedlots, the drought has also created some issues with hay supply for our cow-calf operators, also hay supply for our feed yards, but also grain prices have been elevated to some all-time highs. And so the combination of high feeder prices, high grain prices, difficult to acquire roughage sources and things of that nature, we're looking at alternative grazings and crop residues and potentially, opening up some more CRP for grazing for cow-calf people. when we start to look at high feeders, high grain costs, decreased margins, when we're investing this amount of money, I think it's going to leverage some of these preconditioning programs and the need for them even more, because people are going to be willing to pay for them. When we see high feeders, high grain, it is going to put a premium on performance and put a premium on survivability. So decreased death loss and prediction of being able to project those animals with decreased risk is going to be vitally important in our industry as we move forward. And so I hope that we will see even higher premiums for animals that are managed properly before a change of address, because we in feedlot country are definitely going to have the pressure on to make sure that we do pull out all the stops, just like we do every year, but it'll be even more underneath the magnifying glass because of the high costs of energy, of corn, of feeders, of all the different things out there. So it's going to be a great looking forward in 2023. And when we come back, we're going to talk about some of the other things that are going on within our industry. You're watching DocTalk, and I'm very thankful you joined us.
The Alertus on-farm pregnancy test for us has been unbelievable time saver, because we can do it whenever we want. My favorite part about Alertus on farm, we can get results fast. You know, in 20 minutes, you know whether that cow goes to pasture A, B, or C. It's just very efficient. It's going to make you a lot of money. You're not going to have open cows standing there all winter looking at you, and you can do it on your time.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm a veterinarian who practices veterinary medicine. I have a beef cattle feedlot practice, also an owner and operator in production animal consultation, and I've been very fortunate to also have a part-time appointment where I can help students and engage students with our industry here at Iowa State University. When we start to think about what some of the things that we've seen changing in 2020, 2021, 2022, I don't think we can talk about the beef industry without talking about the beef on dairy cross animals. And we're seeing an increase, continual increase in feeder calf supply coming from our dairies. And really what happens is on the dairy is that the dairyman takes the bottom 2/3 producing cows, and those cows will not be used to create or propagate future genetics. Therefore, it doesn't make much sense to breed them to something of lesser feeding value, because you know that those calves aren't going to go into the dairy genetics pool. So the bottom 2/3 cows in people's dairies are either having a full beef embryo implanted to get them pregnant so that then they can go through a lactation and milk those cows, or they're crossbreeding those dairy heifers or dairy cows with beef semen. And so we will either have beef calves that are raised through this dairy production system, or a beef on dairy cross animal that'll be raised in that. And it's estimated that, you know, if there's 9 million dairy cows in the United States, and 2/3 of them are going to be bred to a beef or beef embryo or beef cross calf, that's nearly 6 million head of feeders coming into the system. And so while we see this decrease in cow inventory, I don't know that people are looking off over here to the corner of the room where we're seeing this huge influx of beef on dairy cross calves. some of the things that we're trying to figure out the proper genetics so we can improve cuttability of the carcass. You know, the dairy animal has always had that kind of a longer looking, thin, not as wide ribeye, and so it's, you know, we're working on muscle and ribeye shape and things to that nature with these animals. Once we have genetics, it's the production system. And do these calves get treated the same as what a replacement heifer would on colostrum and immunology and nutrition as we learn to raise these animals coming into our feed yards at very, very light weights? Some of the production problems or issues that we've seen with these calves has been an increase in liver abscess prevalence. And so we're doing a lot of work to see what are some of the issues that could be caused, whether it's the genetics or whether it's the production system or so on. And then the last one is unless we use sex semen, we actually wind up with some of these beef on dairy cross calves as heifers. And one of the things that we see is about 3 to 5% of these heifers in feedlot situations wind up lactating because of some of the poor habits they have of suckling each other. And so we're looking for some of the answers to that. But I think the big thing is, the big take home is that the beef and the dairy industries are going to become more integrated and more collaborative over the next couple of years. And we've really seen it here in 2022 come full circle with lots of feed yards procuring these beef on dairy cross calves that have a constant supply, not a seasonal supply of cattle that are trickling into feed yards and then into slaughter facilities. We're going to take a break. When we come back, we're going to talk a little bit about exports. We're going to talk a little bit about health, a little bit about traceability. You're watching Doc Talk. We're sure glad you joined us.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson, and we're blessed to have y'all with us today. We're talking about things that happened in 2022 and kind of looking forward to 2023. And one of the things that was a pretty consistent discussion point on when we talked about exports and we talked about pricing is traceability. Now, whether you're for traceability or not for traceability, that's neither here nor there for me. What we have to discuss about traceability in the beef industry is why would we need it? What would it improve? What's it going to cost, and who's going to run it? Okay, and is it going to work, right? There's a lot of countries that have traceability programs, but there's a difference between having a traceability program and a traceability program that works. So we have to have that. Personally, this should not fall on the backs of the cow-calf man or the feedlot or the packer. This should fall in the backs of our country wanting to have a sustainable food supply. And so the cost of the program should probably fall in the backs of the taxpayers. But execution and oversight of the program, we do not want government interfering with this. This needs to be privatized, similar to the way Canada has set theirs up. Now, the question is, why would we want to have it? And I think the biggest reason and the understanding of it is it's not going to increase beef demand. It's not going to increase beef export because we've had record export over the last 2-3 years, right? So what is it going to improve? And really what traceability is an insurance platform to maintain our industry in the face of a foreign animal disease. The example being 2003, when we had mad cow disease, the cow that stole Christmas, we immediately lost a lot of our export market. And it took us 7 years to regain it, okay? It took Canada only 3 years to regain their export market after their mad cow outbreak. But the reason is because most of their exports come to us in the United States. So we were kind of over it science-wise, and domestically we were consuming our beef, and so it really wasn't a big deal for Canada. However, our export, when we start to look at Europe, look at Asia, look at different places that we were exporting beef, our exports shut down, and it took us 7 years to get back to the cow that stole Christmas levels. Where did our market go to? If you look at the graphs, Brazil and Argentina, their beef industries were failing. Their exports were going down at 2003. And what happened was a lot of our customers for US beef then moved to Brazilian or Argentinian beef. And anybody in business understands that when somebody makes a switch to another veterinarian, another co-op, another antibiotic, another pharmaceutical company, whatever, it's really hard to get that customer back because they've changed for a reason and they're satisfied with what's happening. And that was really the big boom, or the big increase in the South American beef, was our inability to track some of these things down disease-wise. So traceability or no traceability, you know, it's not something that just the beef industry and the people within the industry should absorb. We have a long way to go to making a sound system that functions properly. And the reason why we're going to do it is not to increase sales, but more to make sure that we have an insurance program in place to maintain some of that compartmentalization, quick traceability of disease, so that we don't lose export markets in the case of a foreign animal disease. Thanks for watching Doc Talk. When we come back, we'll wrap up 2022. Thanks for watching.
We see you, working hard from the early mornings to the late nights and every hour in between. We see you. We see the pursuit, the desire, the effort, the hope, the goal of being a champion. And we see that you need a partner to keep your animals healthy and happy. With our countless products and quick and reliable shipping, together, we can do just that. To the cowboys and cowgirls, to the dreamers, we see you.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. The most stressful part of the life cycle of a calf is the ride here, whether it's a 2-hour ride or it's a 24-hour ride. I mean, we kind of treat everything like the higher risk cattle. We always have somebody right there at the loadout, pinning cattle, getting counts on cattle. It's just consistently doing the little things right, whether it's clean water, fresh feed, clean pen, clean bunk apron. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on. Our cowboys work directly with our veterinarians. You know, and our guys, they do a great job. Give them a few days to kind of acclimate, settle down a little bit. That gives us a period what we know what we're working with and how we're going to handle them at the chute when we come to process them. We don't process till day 10, 14 or so, and we found better luck with that just because we know what we're working with. And it seems like if they're going to fall apart on you or, you know, start having some BRD issues, you'll find it within that 10 to 14 day period. And Mother Nature, as we know, it can throw a curveball at us anytime, so you never want to get comfortable. And we're using a stimulator now for a vaccine, and they don't go through a harsh sweat or anything. Blends mix is really nice. Cattle look great afterwards, and every day is a challenge. But it's nice knowing that we can rely on a good vaccine, kind of protect us against what Mother Nature or any stressors that they throw at us. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proving that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here, and I am so thankful that the blessings in 2022, all of us here at Doc Talk, we're really excited about 2023 and getting out and seeing more people. It's been a really, really great year, as I mentioned earlier, going from the southeast to the Pacific Northwest. I was down in Thomson, Arizona, Hiram, Utah, Whitman, Nebraska, Michigan, Wisconsin this year. Just a real blessing to meet a lot of you that are engaged day to day in agriculture, and agriculture's in good hands and we're moving forward. And you think about the technology. This year, 2022, is also about technology, and you look at what we're seeing with artificial insemination and repro type of programs. I've seen more veterinarians and co-ops teaming up together to provide management platforms for farmers and ranchers with cow herds and feedlots, ranging everything from developing a herd health calendar to developing nutrition programs to vaccination programs, drop shipping product, helping get cows bred, helping get cows synced, and then providing the right genetics and getting those cows bred, so make sure we have timely calf crops and different things to that nature. But I think that's one of the things I've seen technology-wise, is using veterinarians, nutritionists as more of a management team within cow herds, which makes great economic sense. Some of the other technology that's been moving forward is housing. We're going to see more and more cow comfort or cattle comfort, specifically in feed yards, when it comes to flooring, when it comes to mud prevention, when it comes to heat stress and shade. I think that when some of the things we saw this summer that we have to prepare for feeding these animals to larger outweights during the summertime. Transportation will be something else that you will see improvements in providing cattle comfort and animal welfare. And then when you look at some of the wearables and some of the diagnostics, and we have new diagnostic tests that are in rapid time, so real-time PCR tests, that things that used to take us a week to get results, now we're getting them in 24 hours for respiratory disease or for scours and different things to that nature. And when we look at the wearables on the cattle, the different ear tag technologies that are coming out that allow us to find cattle that are outliers so that we can treat them sooner. One thing we know is that when we treat sooner, we have better case outcomes. And so as we think about that, and we think about developing the new tools that all of a sudden it says, hey, this calf's sick, comes to my phone, I go find a blinking tag and I can go get him and doctor him. As we develop these technologies and understand them better, they're going to just make it easier for us to care for these animals in a better manner. Okay, and but the one thing is, it won't replace the caregiver, the cowboy, the cattleman, the rancher, because and I keep telling people, just because we have a baby monitor doesn't mean we don't need a mother. Technologies just help us do our job better, and it will provide more jobs for people in agriculture, which I'm so bullish on. Every year, at the end of the year, I like to say a little prayer for agriculture, for the men and women and people that are engaged on day to day in the trenches that are helping feed all of our neighbors around the world. So if you don't mind, please join me in a moment of prayer. Heavenly Father, we bow our head in thanks and humility. Today, the men and women of agriculture ask for your guidance and love and are thankful for your many blessings. We're thankful for our country, the United States of America, the breadbasket of our world. We see your native grasses and amber waves of grain that are there for loaves of bread on our neighbors' tables. We hear the cow call for her calf. We smell the fresh water flowing in the stream, and we feel a handful of her fertile soil run through our fingers. We accept our duty to care for and use your livestock to provide food and fiber. Our most precious resource we celebrate is our people. Help us to preserve our heritage and hear the words of wisdoms from those that came before us. Help us to set an example of civility to the next generation as we humbly accept the responsibility of being servant leaders, producing food for the masses while leaving this earth better for the next generation. Help us to put nothing before you and trust you will never fail us. Look over this group and keep us safe as we take on another year to feed the world, lead our communities, and raise our families. In your name we pray. Amen. Folks, I just want to say thanks for a great 2022. Thanks for being a part of agriculture. I'm Dr. Dan Thomson, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.